An intravenous cannula is a small, flexible tube inserted into a vein, usually in the hand or arm, to provide direct access to the bloodstream for various medical procedures and treatments. Intravenous cannulas are used for blood sampling, administering medications, fluids, blood, or blood products, providing parenteral nutrition, and delivering radiologic contrast agents for computed tomography or magnetic resonance imaging. When selecting an intravenous cannula, understanding its size and gauge is essential. The size of the cannula, as indicated by its gauge, is crucial. It determines the flow rate of fluids and the ease of insertion, especially in patients with fragile veins. Note that the gauge number is inversely proportional to the cannula diameter, meaning a higher gauge number corresponds to a smaller diameter, and a lower gauge number corresponds to a larger diameter. IV cannulas are also color-coded, according to gauge size to make identification easier. This system is standardized to help prevent errors in clinical settings, ensuring the correct cannula is chosen for each situation. Now, let's review the different gauges of cannulas. The 14-gauge or orange cannula is the largest, measuring 45 millimeters in length with an outer diameter of 2.1 millimeters. It has a flow rate of 270 milliliters per minute and is used in emergencies for rapid fluid and blood transfusions, major surgeries, and trauma cases. The 16-gauge or gray cannula is slightly smaller. It also measures 45 millimeters in length with an outer diameter of 1.8 millimeters. It has a flow rate of 236 milliliters per minute and is also for rapid fluid resuscitation and blood transfusions. The 17-gauge or white cannula is the least common in clinical practice. It measures 45 millimeters in length with an outer diameter of 1.5 millimeters and a flow rate of 125 milliliters per minute. It is typically employed in situations requiring relatively high flow rates, but where a slightly smaller diameter than the 16-gauge cannula is preferred. This could be in scenarios where the patient has smaller veins that might not accommodate a 16-gauge cannula, yet a high flow rate is still necessary. The 18-gauge or green cannula, measuring 45 millimeters in length with an outer diameter of 1.3 millimeters, has a flow rate of 103 milliliters per minute. It offers a decent balance between flow rate and patient comfort. The 20-gauge or pink cannula measures 32 millimeters in length with an outer diameter of 1.1 millimeters. It has a flow rate of 67 milliliters per minute. It is the most commonly used size for routine intravenous infusions, medications, and blood transfusions. The 22-gauge or blue cannula, measuring 25 millimeters in length with an outer diameter of 0.9 millimeters, has a flow rate of 42 milliliters per minute. It is ideal for patients with smaller or fragile veins, such as the elderly or pediatric patients. The 24-gauge or yellow cannula, at 19 millimeters in length with an outer diameter of 0.7 millimeters, has a flow rate of 13 milliliters per minute. It is typically used in neonates, infants, or patients with very small or fragile veins and is suitable for slow infusions. Lastly, the 26-gauge or purple cannula is the smallest, with a length of 19 millimeters, an outer diameter of 0.6 millimeters, and a flow rate of 10 to 12 milliliters per minute. It is primarily used in neonates or for very delicate veins. It is important to note that cannula flow rates and diameters may vary slightly depending on the manufacturer. The values provided in this tutorial are typical, but may differ across specific brands. Nonetheless, the general principle of decreasing diameter and flow rates with increasing gauge numbers remains consistent across manufacturers. For precise measurements, always consult the manufacturer's specifications. To easily recall the different IV cannula gauges and their corresponding colors, you can use a handy mnemonic like often. General wards give patients big yellow pills. In this mnemonic, often stands for orange or 14-gauge. General represents gray or 16-gauge. Wards is for white or 17-gauge. Give stands for green or 18-gauge. Patients represents pink or 20-gauge. Big is for blue or 22-gauge. Yellow corresponds to yellow or 24-gauge. And finally, pills represents purple or 26-gauge. In summary, intravenous cannulas provide direct access to the bloodstream for various medical procedures and treatments. They vary in size, and each cannula gauge is color-coded to aid quick identification, ensuring accurate and efficient use. Understanding these basics will enhance your proficiency in choosing the right cannula for each situation, improving patient care and procedural success.